Okay, so we will go ahead and get started. Good morning, everyone. I am Robin Mooring. I'm the Students at Work coordinator, and welcome to this session on from Vidant Health, EastCare. And I am going to turn it over to Nancy Turner and Chuck Strickland with Vidant Health.
Good morning. I'm Nancy Turner. I'm the program coordinator with Vidant Health Workforce Development. And Vidant Health is a hospital located in Pitt County, Greenville, North Carolina. Vidant Medical Center is our flagship hospital, and we do have 8 community hospitals located in the eastern region of North Carolina. And I will now pass it over to Chuck Strickland, who is our outreach coordinator with Vidant EastCare.
Good morning, everybody. My name is Chuck Strickland. I'm a paramedic with EastCare. I'm also the outreach coordinator guy. So we cover the entire footprint of the Vidant healthcare system. We have 5 helicopter bases that are out in the region in a variety of places. I'm actually at one in Newbern this morning. The other helicopter bases are in Windsor, Elm City, Mount Olive, and Jacksonville. And we also have ambulance bases scattered out in the region. They usually mirror where the air bases are as well. We usually have around 120 to 140 employees at any given time in our system. We are one of the busiest flight programs in the nation. And that is evidenced by the fact that we have 3 times the flight hours that any other flight program has per airframe. So if you, when you watch the video afterwards, if you have any questions, please ask. This is one of these jobs where it's a really cool job, but it's very stressful. It's very demanding. But at the end of it, it's still a really cool job. You get to do a lot of cool stuff you don't get to do anywhere else. So please ask questions.
Hello, my name is Chuck Strickland. I'm a flight paramedic with EastCare. I'm also the Public Relations Outreach Coordinator for EastCare. We're going to talk a little bit about some of the career opportunities that we have. And I'm primarily going to focus in on the medical aspect of EastCare. However, there are other disciplines that we employ, 2 primarily being mechanics and pilots. I'm not really going to talk a whole lot about them, but just make you aware that those are career opportunities. They're totally non-medical. These guys, their job are to fly the helicopter and to take care of the helicopter. These folks generally come from the military side of things. For example, the pilots, most of these guys come from Black Hawk pilots or maybe Chinook pilots or something on those lines, and they have to have several thousand hours of flight training and flight hours underneath their belt before we can even hire them. And the same thing applies to the mechanics. They have to have a certain amount of experience working on helicopters and airplanes before we can hire them, because it's a big deal. We want to make for sure that our pilots are safe, and one of the ways that you can make sure that they're safe is make sure they have plenty of flight time and experience. Same thing with mechanics. You want to make for sure those folks are very well versed in how to take care of a helicopter not be working appropriately. A lot of transport companies cover a huge area. EastCare covers roughly 1/3 of North Carolina. We got 21 hospitals that we fly to and from, and that's not counting all the fire and EMS services in that area. So we're a very busy program. I host critical care flight and ground programs. These are some of the Vidant facilities that we go to, or these are all of the Vidant facilities with the exception of Halifax Hospital that hasn't been added to the map, or Vidant North. So again, we're spread out all over the place. That's one of the big benefits to helicopters and having the number of ground trucks that we do. We're able to get to where we need to be very, very, very quick. So our air bases are located in Elm City, Mount Olive, Newbern, Windsor, and Richlands. We have them placed in certain specific areas just because we want to have a helicopter to someone who's sick or injured in a very short amount of time. And by having them placed strategically, that's what we're able Ground bases are kind of set up about the same way. We have one in Beulahville, one in Elm City with the helicopter. Greenville has a couple trucks. Richlands has a truck with the helicopter. Washington has a truck. And then Windsor also has a truck paired up with the helicopter as well. We carry some of the sickest people you will ever see. And we're doing this with 2 people in the back. We have a nurse and a paramedic, or 2 nurses, or a paramedic and a paramedic. And one of the things that we transport is an intra-aortic balloon pump. And it's really neat in that this thing actually goes up inside of your body, runs up into your aorta, and it is what we call a counter-pulsating pump. When your heart is contracting, the balloon is actually getting smaller. And when the heart is getting bigger, when it's in what we call systole, it is the balloon inside that aortic is getting bigger, and it's actually kind of helping the heart. So a lot of times we'll go pick up patients. There may be an entire team of folks working on these patients. You may have one person whose only job is to work this balloon pump, and another person whose only job is to work the IV pumps and the medications that are going into that. You may have a respiratory therapist working on the ventilator this patient is attached to. There's only 2 of us, so we have to know how to work this balloon pump very efficiently, work the ventilators very efficiently. So we're always having to learn new things. We're always having to keep up with what we have as far as education, and just stay on top of our game. This is not an entry-level job. You're going to hear me say that several times. This is not an entry job for any healthcare professional, just because of the acuity level or the level of sickness that we're going to be dealing with and see. This is a patient right here, and all full disclaimer, I got this one off of the internet, so I don't know where this came from. This patient here is on multiple drips. They're on a ventilator. They're just super sick, but it's not uncommon for us to walk into a patient room and we'll see this type of equipment attached to a patient. And again, it's just 2 of us that we have to be able to manage this. And the only way we can do this is through extensive experience, training, and just education. So we're going to take all this and we're going to put it into a helicopter. We're going to put it into an ambulance, and just 2 of us have to be able to manage it. We do obviously deal with trauma patients, and we carry blood and plasma. So the important thing with any medication and blood and plasma, oxygen, is to know when to give it and when not to give it. That is highly important. Just because you have it and just because you're able to do something, that doesn't necessarily mean it's always the right thing to do. So what you have to look at is, if I give this blood, or if I give this plasma, or if I give this medication, is it going to benefit the patient or is it going to hurt them? That's a huge amount of responsibility. And you have to be able to accept responsibility for what you do or not do. That's a big thing with this. This is a huge thing as far as just being a responsible adult. You have a lot of responsibility. You have a tremendous amount of leniency in what you can and can't do. And at the end of this, though, whatever decision you make, you have got to take the responsibility for it. It's nobody's fault but yours if it doesn't turn out the way it should. You made the decision to do or not do something. So that's a big thing for us. The other thing is neonatals. That is a very specific subgroup within critical care transport. We actually have nurses whose job is just to manage these neonates. And neonates for us are newborn babies. They may be preterm newborn babies. or they may be a baby that is less than a month old, specifically less than 31 days. So we have these nurses to manage this specific group just because they have a unique set of circumstances that kind of come along with being in the neonatal category. So we have flight nurses, we have flight paramedics, we have EMTs, and we have communication specialists. You actually could say that there is a subset of flight nurses. Their job is to do neonates. We generally have different crew configurations. Right here is what we would consider a critical care ground crew. There is a driver or an EMT. We have a registered nurse, and we have a paramedic. All of them have different scope of practices to a certain extent, and all of them work together. You would never know who was the EMT or the paramedic or the RN unless you specifically ask them. That's how well together they work. And that's another component with this job, is you have to be a team player. You work together as a team. You will succeed as a team, or you will fail as a team. And obviously we want everybody to succeed. And the only way we can get that to work is that everyone works together. The other configurations that we carry on the truck is advanced life support. Each member must either be a paramedic or an RN, at least in the back, and then in the front it can be an EMT, it can be a paramedic, it can be a nurse. There's only one person in the back, one person driving, versus the critical care truck that had two in the back and one person up front. Our basic life support trucks, they generally take our folks from the emergency department back home or back to a nursing home. They may do some inter-facility stuff that needs to come to Greenville or go to another hospital, and all they just basically need is someone to monitor their airway and take a set of vital signs, and these folks generally are not horribly sick. This is what the inside of one of our big trucks look like. On the left you will see the isolette with some medical air on it. We actually carry oxygen and we carry medical air. Oxygen is obviously 100% oxygen, and medical air is just medical air at 21%. On top of the isolette you will see a bag, and this isolette has a little ventilator in it. It has a heart monitor on it, and it has a whole lot of other little things that these little babies need. Again, that's what the neonatal nurse does. Up here on the top, I don't know if you can see it or not, this is the heart monitor, or a heart monitor, and we're expected to know how to use that and read cardiac rhythms. To the right is the normal stretcher that you would see in the back of the ambulance when we're transporting an adult or a child. This is what the back of the helicopter looks like. This patient right here is extremely sick. You can see that they're attaching a ventilator to them. And you see the heart monitor hanging up in the background. This is one of our bigger helicopters, so you can only imagine how small the smaller helicopters are. So there's not a lot of room in these things. They're hot in the summertime, they're cold in the wintertime. It's not oftentimes a very comfortable environment. It's very, very loud. So when you're in this helicopter, oftentimes we wear earplugs inside of our helmets to protect our hearing, just because it is just so terribly loud. And on top of that, when we're trying to deal with patient care, we have multiple radios that are going off inside of our helmet. And you've got to be the type of person that if that stuff is going off in your ears, that it's not going to be a distractor, that you're able to continue to do patient care, but listen to the radio, because there may be an aircraft approaching that you need to be on the lookout for. It's multitasking absolute best. This is another picture of the inside of the helicopter. The one that is not blue. To your left, you see the ventilator setting up in the wall and some of our IV pumps. This is part of our console as far as our oxygen and suction console. And the center stack, what we call it, the center stack, it actually carries it carries our liquid oxygen. And then we also have, at the top here, we have our radio. You can see one of our helmets in our chair. To the right, you see the blue. We actually operate under blue light at night, and that is so that we don't damage our night vision. When we are flying in the back with a patient, we are what we consider unaided. We don't use night vision goggles, but our pilot is, so we use this blue light so that it doesn't reflect into the windscreen and cause a kind of like a glare, so that it would make it difficult for him to see. So this is what it sounds like inside the helicopter. If you didn't have in earplugs, it's really, really loud with some high-pitched noises. So again, that's why we're wearing earplugs. You can't hear the radios going off, but this helicopter's talking to a fire department that is on scene, guiding them into a place to land. And at night, it's very, very beautiful. It also can be kind of dangerous in that if you don't have someone on the ground communicating with you very effectively and clearly, you may not find where you need to land. So you have to fly around until you find it. Alright, so this picture here is what it looks like to be flying under night vision goggles. It's probably not the best in the world. I'm sorry. That's the best I could find. You will see that it is any color out there, as long as it's green. That's pretty much all we see is green, or a different shade of it. The line that you see off in the distance is a long ways away. It's about 100 miles or so away. It looks close, but these night vision goggles, they pick up so well that they can see right there is turned back dark, and it's very hard to see the lightning. I've lifted off the upper pad at Greenville, and I have seen the lighthouses on the Outer Banks. As far as their light beacons, not the actual house, but I've seen the light beacons turning, which is really, really cool. And that's off of these night vision goggles. So this is what it is like to land in the daytime, and it's really, really neat to get to do. These are some of our trucks that we have. This truck is considered our ALS and our critical care truck, just because we can do both in it. It actually has a lot of room in the back. It actually has more room in it than we did in our big trucks that we used to have a lot of. And the truck to the right, that has the 460 on it, that is what we call our BLS truck. Those are the trucks that we use to take folks home or back to a nursing home. This is what the inside of one of these trucks look like, or this is what all of them are going to. And it looks a lot different than a 911 ambulance in that you've got these metal things on the wall that we can mount things to. And this is what it looks like on the inside. I did my best to try and do a 360-degree picture of it. And I'm not totally sure if the camera totally cooperated with me. But I kind of wanted to give everybody an idea of about what it looked like. Again, it's a lot different than what you would see in a 911 ambulance. And believe it or not, there's actually more equipment in this ambulance than there is oftentimes in 911 ambulances. And we have very specialized equipment in here as well. Again, we carry the IV pumps, we carry ventilators, we carry heart monitors. You don't see any in this specific truck just because it's one of our backup trucks that we carry. What will happen with that backup truck is it'll sit just as it is right now, and then when another truck needs to have an oil change or a tire repaired, they'll pull their equipment off of their truck, put into this truck, and they are ready to go. This is the big truck. Again, believe it or not, this truck doesn't have as much room in it as the small trucks do, and they ride really, really bad. This is one of our communication specialists, or we also call them dispatchers. They are super important for EastCare. Their job is to take calls. So when someone calls in to EastCare, they will find out where the patient is, how sick they are, what kind of medications these patients are receiving, and where we need to take them to and within the Vidant system. So we may wind up taking them to the emergency department. They may go to one of the many ICUs that Vidant has, or they may wind up going to the operating room or to the cath lab. That it's their responsibility to get that information. So these folks already from the word get-go, these guys have a super important job. If they don't get that information correct, then the whole call is messed up. So they work very, very hard to get us the correct information. They're very attentive to details, and again, they are very, very important to us. They not only do they do call taking, but they track our helicopters when they fly to different places, and when our ground trucks are sent to different places, they track them. And we have one communicationist specialist whose only job is to track the helicopters, another one whose job is to only track the ALS trucks, and another one whose job is only to track the BLS trucks. And that's a really big responsibility because we need to know where these trucks and aircraft are at all times in case there's a problem, or in case they're coming back from a call and they get another call. We need to know where the closest trucks are to get help to a patient if possible. Qualifications to be a dispatcher: you must have prior EMS or dispatch experience, meaning you must have run on a 911 ambulance somewhere, or you must have worked for a 911 center actually taking 911 calls. The reason we want that experience is, again, these folks have a huge amount of responsibility on them, and they have to already have some idea of how to organize themselves and what we're doing. You must go back to school and get your EMT if you don't already have it, or your emergency medical dispatcher. The other one, IAMTC, is an international certification for air medical and critical care dispatchers. It's a super hard test. Emergency medical technician. These guys are the backbone of our ground transport service, in that if we don't have them, we probably wouldn't get to go a lot of places. They drive our ambulances, and a lot of times we will call them drivers, and that's not entirely accurate. They do a lot more. They do patient care. They are the ones they're responsible for that truck. They are responsible for the safe operation of that truck. They're responsible to make sure that our oxygen is restocked. If we use something like that truck, they help us get that restocked. And they also help us at bedside because they are considered a medical professional. They help us at bedside oftentimes. And if they've been trained to work in the communication center, oftentimes they can fill in within our communication center if they're needed. You have to have 3 to 5 years to come work for us. You must be 21. You got to have a good driving record. And it usually takes about 6 to 9 months to go through EMT school. And a lot of high schools now are offering the EMT certification in your junior and senior year. You got to be 18 to hold an EMT certification, but we hire you after you're 21 and once you're 21 and older. Flight nurse, 3 to 5 years experience. You need to be an ED or an ICU nurse, and you need to have at least 3 to 5 years as an emergency department nurse or an ICU nurse. Can't just be 3 years as a nurse and 6 months in the emergency department. You've got to have minimum of 3 years in either ICU or emergency department. Some nurses who have, this is what they have always wanted to do, will do both. And I really take my hat off to those folks who do that, because that's really hard. It's 2 totally different mindsets to work in the emergency department and work in an ICU. And then some of these nurses will go ahead and get some of their prerequisite training ahead of time before they even interview for us. You can start with us as a 2-year associate degree nurse, but you have to have your bachelor's degree within 5 years of hire. So that's the thing about this job, is you start off, you go to school, and once you get a certain amount of experience, then you get hired and you have to go back to school and pretty much continue to go your entire career. So once you get hired within the EastCare system, you go to school for an additional 4 months. It's just like any other school. You've got tests, you've got practicals you've got to do, and you've got to pass them. Once you have been at EastCare for a certain amount of time, you have to have at least your emergency medical technician, your advanced cardiac life support, your basic cardiac life support, your pediatric advanced life support, your neonatal resuscitation program certification, your trauma nurse core curriculum certification, and then you must also be certified as a flight nurse, certified emergency nurse, or a certified critical care nurse. Now these are tiered as far as within the first 6 months you must have certain things. Within 12 months you must have certain things, and within 2 years you must have your certified flight nurse or critical care nurse. Flight paramedic, 3 to 5 years experience in a busy 911 system. And again, you must be 21, you must have a good driving record, and you must now, at some point, North Carolina is looking at making the requirement that all paramedics must at least hold an associate's degree. So you're going to have an associate's degree anyway to be any paramedic. Once you get into EastCare, again, you're going to have to go back to school for another 4 months. Again, you're going to have to take tests. You're going to have to do skills checkoffs and practicals. Have to have advanced cardiac life support, basic cardiac life support, pediatric advanced life support, neonatal resuscitation, international trauma life support, or pre-hospital life support. Now, the difference between these trauma programs versus the one that was listed with the nursing is that this one is geared specifically for paramedics and the other one is geared specifically for nurses. We have to take a specialty certifications to be a certified flight paramedic or certified critical care paramedic. We have to have that done within a certain amount of time. Again, we're no different than the nurses. We have to have all these specialty certifications to maintain our job. Once all that is done, we have to continue to go to school. We on a regular basis have some sort of education. It may be through an online learning module. Maybe we're taking a PowerPoint online and we have to take a bunch of tests to go with it. Or either we have to go and do practical skills like what you see here. This gentleman here is posing beside his mannequin before he has to do a This is another picture of another crew working. Again, they're working a scenario and they're having to work together and they're working through protocols and policies, and out of this, each patient presentation will be a little bit different so that everybody learns a little bit of something. Again, 100 hours every 4 years really isn't a whole lot, but we generally average a little bit more than that. Usually we're averaging around 36 hours a year. They're on specific topics, and these topics have a certain hourly weight to them. So you can't just take a 30-minute lecture on airway and meet your requirements. You actually have to have so many hours in airway, so many hours in cardiology, so many hours in trauma. And it's your responsibility as a professional to take care of education and kind of monitor where you're at and what you need. Here's some more pictures of some different classes that we take. You see on the upper left-hand corner, a gentleman in a black shirt with a mannequin. Looks like it's in a little tote box. It's actually got simulated vomit in it, and we have to learn vomit and blood. So we have to learn how to intubate and manage an airway with vomit and blood in it, which sounds kind of gross, but that's kind of what we have learned. We learned to do. The center top one with the fire truck in it, we go to extrication training with the fire department. Not that we have to know how to cut people out of cars, but we have to understand how the fire department cuts people out of cars so that we can work safely around those tools and manage our patient appropriately. The top right picture is one of our flight crew being dunked in a pool. We go once every 2 years, and we go and do what we call dunker training / water survival training. We have to know how to get out of the aircraft and manage ourselves if we were to have to make an emergency landing in water. And then the bottom picture is our wilderness survival training that we go through every couple of years. And it teaches us how to take care of ourselves if we were to have to land in a wilderness area and wait for someone to come get us. So I hope this has helped you guys a little bit. I really appreciate you guys taking the time to listen to what I have had to say today. And I hope you guys well as far as determining what career path you would like to go down. I'm a little bit biased, and I hope to see some of you guys later on in fire and EMS or in critical care. And again, thank you so much for your time.
Okay, does anybody have any questions? All right, what is the pay range? It depends on whether or not you are a nurse or paramedic. Obviously, the nurses are going to make a little bit more than the paramedics do. Right now, we're actually hiring inexperienced people. It's kind of something that's changed because of the whole way the dynamics of the workforce. We're actually now have started a new division within EastCare, and you can be a brand new paramedic out of school, and they're starting you off about $20, $22 an hour. And you factor in that, you're going to get shift diff, you're going to get weekend diff, and every paycheck you generally get about 8 hours overtime. So all that kind of adds up, and you do actually make pretty decent overall, especially for what you're doing. That's a good question. All right, what else? Anybody got any other questions? What classes?
There's another question here that says, what classes should you take in high school if you're interested in any of these types of careers?
That's also a very good question. it depends on which pathway you're going to go. If you're going to go through the registered nurse pathway, then obviously you've got to have your registered nurse. You need, if you can come in with your BSN, that's one less thing that you have to worry about. You can come in with as an associate's degree. As far as degree wise, you do need to take you need to walk in with advanced cardiac life support, basic cardiac life support, pediatric advanced life support. Those need to be under your belt when you walk through the door. And those things you're going to get over a period of time anyway. This is not something as a flight nurse or flight paramedic that you're going to jump in right out of school. This is a 3-year ordeal. So you've got 3 years to go get your advanced cardiac life support, your pediatric advanced life support, everybody, if you're doing anything in healthcare, you're going to have basic CPR. Go ahead and get your neonatal resuscitation program out of the way. Start studying for your flight nurse certification early on, because when we actually test you for a job here, we give you very similar test questions, and just to kind of see where you're at in your base knowledge. And that just helps you too. When you start your orientation, you've already done a lot of studying and preparing for some of the things that you're going to see. And once you start putting your hands on those patients after you've kind of taken different classes, it all kind of starts making a little bit of sense. The paramedic is pretty much the same. You're still going to need your advanced cardiac life support, your CPR, your pediatric advanced life support, and your neonatal. You do have to take a trauma class for paramedic. It can either be international trauma life support or pre-hospital trauma life support. The nurses also have to have TNCC, which is Trauma Nurse Core Curriculum. The more of those you have when you walk in the door, the better you look to us, because that's training that we don't have to invest in you. You've already invested it in yourself, and we know that you want to learn, because this is you're a lifelong student in this job. Sorry, that probably was a lot of information.
No, that was good. If you're interested in these careers, what are some of the kind of mental health skills, interpersonal skills that a student should work on developing? You mentioned that it was at sometimes a stressful job, obviously adaptability, but what would you suggest that a student needs to work on for this?
Well, I'll be honest with you. You can't teach compassion, and you've got to have compassion to do this job. And I can teach you the hands-on, the didactic component and the hands-on skills. I can teach anybody that, but what I'm after is, and most of us in leadership, we're after compassion. We're after the fact that you care about your patients, you care about your coworkers, and you're able to effectively communicate with a variety of different people. You're going to be talking with doctors, you're going to be talking with nurses. They have their unique set of vocabulary that you've got to figure out what they're saying when they're saying it. And respiratory therapists, that they're a totally different unique subset. And just that ability to be able to communicate with a variety of educational bases. Some folks that we pick up may not have graduated high school, so you have to learn how to communicate with those folks. You have to change the way you talk to folks, depending on what their base educational level is. And that is, you can do that through a variety of classes, but a lot of it, you have to sit back and just be patient and understand, the audience that you're talking with, if that kind of makes any sense.
Yes, thank you. As we're kind of coming to the end of our time, is there a way for you? I know you're right there at the helicopter. Didn't know if you could pan out again. Let us see the helicopter. It's such a cool view of everything.
This is actually the patient compartment right here. This is one of the smaller helicopters. As you can see, this stretcher is 6 foot long, and I don't know how well y'all can see to the back. I'm trying to, but you can, as you can tell, there's really not a whole lot of room in towards the back of it. This is our ventilators, our IV pumps. We actually have extra bags that sit up against the wall. I don't know if you can see it for the shadows, and come around. And so this is actually the flight suit that we wear. This is made out of Nomex. Everybody has to wear it. You have to actually wear certain specific type of undergarments. You can't wear just any and everything. There's certain things you cannot wear. And up here, we don't mash those buttons. The pilot does. I don't know if y'all can see that. There's too many buttons up there for us. And I don't know how this is. The little silver thing, we actually have to put a silver thing over the dash to protect it from the heat. Did that? Y'all get did
Great. Yes. No, we could see well. Thank you.
Okay.
All right. Well, we're at time. Thank you so much. We really appreciate you sharing with us today. I believe, Nancy, you mentioned if we had questions or anybody has follow-up questions that they can reach out to you and contact you. Is that correct?
Yes, I can put my email in the chat if you would like me to do that.
Sure, that would be great. Thank you so much.
Now,
Thank
one
you to
thing
all
I also say is that, providing that these students are 18 years old, and kind of depends on what happens with COVID. Once COVID kind of dies down and our visitor policy changes a little bit more, and as far as shadowing, folks who are truly interested in doing this, I'll be happy to bring them in once COVID kind of dies down and the hospital will allow it, just to let them shadow and spend some time with us, because I want them to go into this with their eyes open and know exactly what they're getting into.
Thank you for sharing that. So you're available, as you said, once you're allowed to have that type of visitor, but you do allow job shadowing opportunities for high school students 18 and older. Is that what I heard you say? 18
and older, and there's a release form, and that releases us from if something bad would happen, if they were to get hurt or something like that, which this can be a dangerous job. So they need to know, they need to know what they're getting into.
Excellent. Thank you so much. We really appreciate y'all's time. And once again, Nancy Turner put her email in the chat. If anybody has any follow-up questions, please feel free to contact.
Excellent. Thank you.
Thank you for joining us today.
Thank you so much.